Good afternoon and good morning. This is the 1662nd day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Mini Mehta from Delhi. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. And from 8:30 to 9:30, we have an international session in English from 9:30 to 10:30, a local language session in Malayalam. We are uploading the videos of the same on the very next day itself at YouTube so that those who miss the session can watch it again. You can subscribe the same without paying any money, as well as you can share it with your friends, not only with the homeopathic doctors, but also with the homeopathic students and homeopathic lovers too. And the purpose of this forum is to take homeopathy to every uh, house around the world, as well as connect between doctors among the world. And this is the purpose, and we are doing all these things for the last 1,661 days. And let me come to today's guest. As you all know, today our guest is Dr. Mini Mehta. She has completed BHMS and is a PG homeo from London. She got, and she's had done a certificate course in oncology. Currently posted in palliative care physician at Rajiv Gandhi Cancer Hospital, New Delhi. She has specialized areas. She is a person who loves holistic medicine, mind and body and soul, and integrative oncology, pain and palliative oncology, supportive care in oncology, reducing the side effect of conventional cancer treatment, such as nausea, vomiting, vertigo, fatigue, and benign tumors and growth, allergies and inflammatory diseases, skin diseases, neurological diseases, endometriosis. At present, she is also a faculty at London College of Homeopathy, United Kingdom, and she has done practice in different hospitals also. Wellness consultant, Star Wellness Center, select our New Delhi, and general homeopathy consultant as Bhagavan Mahavir Hospital, New Delhi, homeopathic consultant as Vardhaman Jain Hospital, Rohini in New Delhi, and she has presented various purposes in different parts of the world as well as in India, and she is the winner of many awards. She is a person who has uh, published some research papers also, and today Doctor will be discussing about one of the best subjects that homeopathic doctors usually getting, and that is diseases of the women and its homeopathic treatment. So we proudly welcome our guest of the day, Dr. Mini Mehta. Welcome, Doctor.
Good evening, everyone. Thank you very much for such a long introduction. Please, next time mention only my name and that I'm a homeopathic practitioner. So, can you all see my screen?
Yes, please.
I'm just laughing it.
Okay.
Can you see it?
Yes, yes, everything fine. You can go
So
ahead.
today I have picked up this topic, female pelvic pathology, because this is a very favorite zone of every homeopathic doctor. Because in female pelvic disorders, allopathic doctors have not so many things to offer other than the hormonal pills and some anti-allergic or some supplements. They don't have much to offer. Uh, and also, when they start treating with their hormones and other supplements, it sometimes increases the problem rather than decreasing it and adding more problems to the people. So I would like to discuss on this so that because I know you all are treating lot of females, lot of PCOD cases, lot of endometritis, lot of most the disease which is mostly nowadays is in fashion is endometriosis, and at endometritis you must be treating, and atrophy of ovary and cellulitis of ovary and para-ovarian cyst. You all must be treating all these things. But still, there are some people who have not taken homeopathic treatment properly. They spread the word that homeopathy is slow, go for surgery, your case will get ruined. For that reason, we'll start with a case to see how fast homeopathy can help the people with painful cyst, which which creates a situation when a surgeon tells you that you need an immediate operation because maybe this tumor or cyst can burst and you can get into more problems. So I'll start with a case. See, this is a case of a girl who was 20 years old, and she came to me on 8th of July in 2016, and she was having severe pain in the abdomen, and she had a right ovarian cystic mass, which was 47 into 54 into 34 and she was having very painful bleeding, profuse bleeding, and this complaint was very excessive, uh, and it means it was affecting the patient very much from past 3 months. She was bearing this with painkillers and everything, but now the surgeon told her to come in next 3 days to get this operated. So this girl came to me, and I took the entire case, and I got to when she was giving me her symptoms, then she told me, Doctor, this is such a bad pain, just such a pain as if somebody is cutting and stitching and stinging here again and again. This is such sharp pain, and I can't tolerate it. She was clenching teeth and telling me about her complaint. So this kind of behavior or nature while expressing her problem instigated me to ask more questions to her. Then I asked her, okay, when did it started? Do you get angry often? Then after taking a case, I got to know that she was feeling very much revengeful towards her sister's husband, who was continuously torturing her sister, and her sister she he was beating her sister regularly, that her sister aborted third month only. So she wanted to take revenge from that person. She had fights with that person, so she was holding a lot of anger and revenge, hate towards that person. And so many other things I asked, where I got to know that she usually get mouth ulcers, very painful mouth ulcers, and so many other things. Then all the symptoms indicated to acid nitric 30. I started giving her acid nitric 30 because there was pathology also. So I never wanted to start with 200 or 1 one dose. So because there was a lot of pain, so I wanted to repeat the medicine. So I started with acid nitric 30 aqua doses, to be taken 4 times a day because she was having very acute pain. And then I told her ki if it gets better, you can increase the gas and show me after 2 weeks. After 2 weeks, when she came, she was feeling much better. Then I gave her the medicine, and I told her to take it twice a day. And then I told her ki if it's all right, then don't come. If you get some problem, then only come to me. Otherwise, after a month. Then first time she came to me on 8th of July. Then 22nd of August, she got her ultrasound done again because the pain was completely gone. So now there was no cyst. Now there was no cyst in the ultrasound. Also, there was no pain. So this is the beauty of homeopathy, that there was such a big cystic mass which was very painful, which to touch, to without to it was paining her when she was walking, and it got resolved within a month only. So this is how fast is homeopathy, if you want to imagine how fast it works. Now another, this is the case of a girl. She was having two right ovarian cysts. One of them was complicated, likely a endometriotic one or a hemorrhagic cyst. Another one was a simple cyst. And this girl came to me on 14th April 2018. and she was also having pain in the right side of the abdomen, but her main problem was that she was having big, big swellings on the face and angioedema in the different parts of the body, and mostly angioedema over the face, which used to be massive in the morning time and used to get reduced as the day progressed. So I took the entire case, and according to the whole case, the constitution was indicating me natramuse. So I started treating her with natramuse, and then in between a day came and she was having a lot of swelling on the face. At that time, I gave her APIS also for acute complaint. And then after 4 months, she got her ultrasound done, and there was no cyst. Only grade 1 fatty liver was there. There was no cyst was found. Also, she was not suffering that angioedema, just light swelling sometimes over the face she could feel, and that too during the periods only, and she was much better. So you can see how fast and how uh, smooth is the homeopathic treatment, how effective is the homeopathic treatment when we treat the females who are suffering with it, hormonal diseases. Now, this is the case of a female. She was suffering with seedling myoma, right? Para-ovarian cystic lesion, likely focal hydrocephalus. She was also suffering infertility, but she used to get a lot of migraine, half head pains, and lot of problems and like headache, indigestion. There was a lot of associated complaints with all these uterine complaints. And when I took the case, I got to know that she was married at a very young age because her father died and she was a very young girl, 10 years old, and she was raised by uncles. So they got her married at a very young age to a man who was alcoholic. And she was a very beautiful, fine looking girl, but that man never, valued her. So she was very angry. So according to the symptoms, her symptoms indicated to sepia. I helped her with sepia, and then I had to give her carcinosin also as intercurrent remedy. And then she came to me after when she was feeling better. We got her ultrasound done, and there was only a seedling myoma. Rest all the complaints were so much better. Now there was no hydrosalping. So this is how homeopathy works. So I've shown you one case of simple cyst, painful hemorrhagic cyst. Second, I showed you a case where the cystic growth were associated with urticaria, angioedema like symptoms. And now this case was there with hydrosalpinx, para-ovarian cyst. Now another case I will discuss. This was a case of endometritis. This lady was suffering from so many years, and she was going to one allopath to another allopath, but she was not feeling confident to get her uterus removed. She was already suffering infertility, but she adopted a child. But now she was having comorbidities like she was having diabetes, and also mentally she was suffering with this extreme fastidiousness. So the story of this lady was that uh, she got married to a man who was very simple and not very ambitious to earn more and more money. But this lady was very ambitious, and she was from a family of people who were very ambitious, and gradually they attained a lot of financial growth that their level raised so much from her husband's level, and she wanted her husband to be very smart and ambitious and do the same thing, but he could not. He was a very religious and simple man. So she was not against her husband, but she was not fond of him. So I gave her sepia. Sepia helped her for longest time. But then she uh, she gave me the symptoms that she was having stiffness in the calf muscles, and which was better by rubbing it very hardly. I had to give her plumbum met also. which helped her. Then she was extremely fastidious, but one day I got to know that she keeps on washing her hands all the time. And even if she gets to know that the husband has visited the neighbor's house who was menstruating, she knew she was after his life that he should get uh, he should take a shower. And if some lady comes to her house and she gets to know that she was menstruating and she sits on her sofa, she used to wash everything. So I gave her cisalinum also, which helped her. And this is how symptom to symptom I treated her. She started getting better and better as a person also. And then, see, first the endometrial echoes were 14 thick, minimum fluid in pelvis. Then when she was better, the next was 13 homogeneous. First heterogeneous thickening was there. Now homogeneous cystic changes were suggested of cystic endometrial hyperplasia. And but now her bleeding was not that painful when we got this done. It was under control. But this this impression came. Next, when she was feeling better, we got it done because we were regularly monitoring. And then there was, whenever I see any endometritis healing, it goes back to as endometrial polyp. And when it starts, it also starts as endometrial polyp. At this time, when she was having this endometrial polyp, I know all her symptoms indicated me to give her calcarea calf. She was sweating, head and neck very badly, and she was very, again, financial insecurity was there. But her craving, her anemia, her sweating indicated me towards calcarea carb. I gave her calcarea carb, and she got much, much better with her diabetes and general health and everything. Then, after some time, we got her USG done. That time, the endometrium was thickened only, and there were tiny cysts. She was better, and then we got her ultrasound done again. The treatment was continued with regular consultation. Then she was only having mild hepatomegaly with fatty infiltration, and uterus was normal, and there was no endometritis. So this was 2009, and she started treatment. She started. This was the old one. She started taking treatment in 2018. So her uterus was saved. In 1 year, everything got better. So this is the scope of homeopathy. If the patient is regular with us, if we are able to if we are able to take care of every complaint of the patient very diligently, then every kind of varied diagnostic headings, labeling coming to us, we can treat all these syndromes, uterine and ovarian syndrome. And we have read it in from the psychological point of view, like Dr. Hammer's point of view, that if a lady is suffering ovarian complaints, if it is left-sided, it is due to some conflict related to the loved ones, loss of brother, loss of mother, or some very important thing, money in your life, or right-sided, it is lost due to loss of money or husband side. And if it is a uterus fibroid or endometriosis, this means the lady is worried about the financial things. She is constantly thinking about the procreation. When it is in the mind, there are some financial problems, and she want to compensate with it. She want to help in it. She's worried about it. Then all these complaints in the uterine complaints come. Or if female is worried about the relationship with her mother, then also uterine fibroids, this kind of pathology comes. So this is a psychological point of view which we get from Dr. Hammer's German New Medicine. We all should read, because in most of the cases, if you are able to you know speak to your patient and he's able to tell all his you know personal things, then you'll get to know that there is kind of 70-80% reality in all these things. So let us discuss the therapeutics which are indicating towards all the female pathologies. So I have listed all the remedies from A to Z, what I feel like they are important. I started with the cases because sometimes we start with the therapeutics and cases are left. So now we'll start what all remedies are very important for us. Number one is APIS. APIS is so important. It is important for the edema of labia relieved by cold water. When do you get edema of labia? In lot of patients, young girls, you will get Bartholin cyst, the gland which lubricates the vagina. When there is swelling in that, when there is a Bartholin cyst, APIS is the best remedy. Edema of labia released by cold water, soreness and stinging pains, inflammation in the ovary, ovaritis, right-sided. APIS is always, most of the times it is indicated in the acute pain. Menses are suppressed with cerebral and head symptoms, especially in young girls. They will tell you she is having a problem of epilepsy or she cries suddenly in the sleep. You will see that she'll wake up with a shout, with a loud cry. Dysmenorrhea with severe ovarian pain, as something is stinging in the right side. Metorrhagia profuse with heavy abdomen, faintness, stinging pain, sense of tightness, as if it is going to burst, bearing down as if menses were to appear, ovarian tumors, endometritis, metritis with stinging pain, great tenderness over the abdomen and uterine region. APIS is a very common remedy, very, very common remedy. Patient will tell you that I feel heat also. Thanda lagane, something, if I feel better by application of something cold, some cold thing over there. Next is bryonia. Bryonia, whether a female is suffering a breast problem in the breast, ovary or uterus, bryonia is the best remedy. After giving birth to the child, when there is a lactation time, in the second, third week, when the mother is learning to, feed the child, sometimes there is overfilling of the breast and it feels like stone. And the female gets a very high fever. Bryonia is the best medicine. Menses too early, too profuse, worse from motion. Worse from motion is the indication. With tearing pain in legs. Worse from motion is the important thing. Suppressed with vicarious discharge or splitting headache. Stitching pain in ovaries. In APIS, it was stinging pain. Stitching pain in ovaries on taking a deep inspiration. Slightest movement, even an inspiration was increasing the pain. Very sensitive to touch, but not that sensitive what APIS was, what belladonna is. Pain in right ovary. This is also indicated as, like similarly like APIS. Pain in the right ovary as if torn, extending to thigh. Two more remedies have pain in the abdomen extending to thighs, lilium tick and crocus. But in crocus, you know what is the special indication of crocus? The the menstruation coming out of the uterus hang in strings, black, long strings. The patient will tell you, my blood comes out in as if long black threads are coming out. Bryonia is good for milk fever, pain in breast at menstrual period. The patient has to hold the breast so that it should not feel any jerk while walking. Breast hot and painfully hard, abscess of mammary, frequent bleeding of nose at appearance of menses, menstrual irregularities with gastric symptoms, ovaritis, intermenstrual pain, with great abdominal and pelvic soreness. Great abdominal and pelvic soreness is also there in hemimelis. So this is bryonia, very, very important remedy to be given to a female who is suffering with hormonal problems. Next, arsenic, menses too profuse and too soon. Patient is very restless, despair of recovery. There is burning pain everywhere. Leukorrhea is acrid, burning, offensive, thin. Pain as if from red hot wires. Worse, least exertion. There is lot of fatigue in the patient. If you see patient is telling you whatever reports she's showing you, but you can see extreme restlessness and fatigue in the patient, and then you have to confirm for three more symptoms of arsenic like burning and other things. If the three keynotes are confirmed, arsenic is the best medicine to be suited to that lady. Menorrhagia, stitching pain in pelvis extending down the thigh. Now, a very, very good remedy, or a mute netronatum. I think almost everybody who's treating fibroids of uterus, big fibroids of bulky uterus, they are giving this medicine to their patients with great results. It is a salt of gold, sodium, and chlorine, introduced by Hale and Burnett in treatment of serous carcinoma of uterus and breast. You know what all medicines I'm mentioning? Every medicine can be given in the cases of cancer, because what Hahnemann has said, no matter what is the scenario of the disease, if the symptoms are indicated, that is the medicine suitable for that particular condition. But aurum netronatum holds a reputation to be which like it is capable of treating the serous carcinoma of uterus and breast. The symptom picture embraces the themes and polarities of aurum met, suicidal tendencies, with depression, ideation, disappointment in love, and the natramure themes of natramure attachment, themes delineated by Scolton. If you'll read about natrum and mure, he has given a very good description of that. The natrums are a sensitive, vulnerable, alone and lonely, impulsive, withdrawn and closed, holding on. Silent grief and depression are strong points. Like I will give you an example of a lady who had a bulky uterus with so many fibroids in that, and she started suffering it because when she was very young, she got uh, in an like she fell in love with a man who was already married. But when she fell into the relationship, she never knew that this man was married. Then this man committed with her and told her, I'll get married to you, I'll leave my wife one day when my children will be grown up. Then she waited for him. But when his children were grown up, he told her that I can't marry you because I have to take care of my children, and I don't feel like I am able to give them some life, or I'm not also financially sufficient to take care of my children. I have to be with them. So she got disappointed in love. But after this also, she told her husband, fine, you can't leave your wife and you want to take care of your children, I'll help you. So this lady, she was also working. She kept, helping this man financially to raise his children, to give education, to, a good education for his children. So this lady who suppressed her own feelings, love, and still she was supporting that man. So aurum netronatum suited her so well for her complaints in her uterus. She had multiple intramural fibroids, so it helped her. These kind of people need such medicine. Bovista. If some patient comes to you, complaining about menstrual problems and other things, then if you get these symptoms and diarrhea before and during menses, patient will tell you that otherwise I'm fine, or I'm constipated, I pass motion in 2 days or one day. But I feel, doctor, whenever my menses are approaching, my stools get loose. Once my stool get loose, I get to know that I think my periods are going to come tomorrow. Diarrhea before and during menses. Menses too early and profuse. Worse at night. During the daytime, the pad will not get filled. Only when she will wake up, she will get her periods also during night time. First period also, every month also. The bleeding is more at night and very less in the daytime. Voluptuous sensation. Leukorrhea is acrid, thick, tough, greenish leukorrhea after menses. She cannot wear tight clothing around the waist like lattices. traces of menses between menstruation. So these ladies will tell you, doctor, on my 14th day, I think I can sense my ovulation because I think on 14th day I get a small spotting very or a thread-like thing I could see in my urination. Soreness of pubes during menses. Sometimes it is very difficult to get these symptoms out of the patient unless you're not very close or they don't trust you. Soreness of pubes during menses. Like, they will tell you that sometimes we turn in the bed, we feel severe pain in the pubic bone. Metorrhagia and para-ovarian cyst, if you find in their, ultras, ultrasonography. Bovista, if the symptoms are indicated, you can give Bovista. Bromium. Whenever there is swelling of ovaries, like you will see it in the diagnosis PCOS, but the volume is less than 5. But still, there is PCOS, and menses come too early, they're too profuse, and the bleeding is like membranous shreds. The patient is very low spirited before menses. Along with that, the patient has tumors in breast, the stitching pain, worse in the left, stitching pain from breast to axillate. Stitching pain, whenever you're taking menstrual history of a lady, of a young lady, you should always ask about some pains in the breast or the area around it. Sharp shooting pain in left breast, worse pressure. Like in Bryony, it was better with pressure. Next, calcarea calf. Calcarea calf helps every age group. Very younger one also, older one also. Before menses, the headache, colic, chilliness, premenstrual syndrome, it is good remedy for premenstrual syndrome. Cutting pains in the uterus during menstruation. Menses too early, too profuse, too long, cold clammy hands, sweaty head, toothache, damp feet. Mother will tell, ma'am, she will be under the blanket, but her feet will be extremely cold. We have to, help her to get them warm. Even in the socks also, she has a damp feet. The least excitement causes their return. Uterus easily displaced. Leucorrhea is milky. Burning and itching of parts before and after menstruation in little girls. Mother will tell doctor there's some problem. I think, I often see her scratching her private part. Is it all right? Then you need to ask whether there's some discharge or not. So if there's some milky discharge, you can think about calcarea, carbon, sepia, and according to the constitution and few more questions, after asking few more questions, you can easily decide. Increased sexual desire, easy conception, hot swelling of breast before the period, and better when the periods come. Breast tender and swollen before menses. Milk too abundant. Disagreeable to child. Deficient lactation with it is it is given for too abundant milking also and also deficient lactation. With distended breast in lymphatic women. Lymphatic women, कफ प्रवृत्ति वाली means lymphatic में flabby, much sweat about external genitals, sterility with copious menses. Like if somebody comes to you with hydrosalpingo and has all the symptoms of calcarea calf and copious menses or uterine polyps, calcarea calf, if the symptoms are indicated, calcarea calf is capable of helping that child, that female. Conium again, the best medicine for all the glands, whether the breast gland or the uterus or the ovaries. It is the best medicine suitable for any type of hormonal problem. Dysmenorrhea with drawing down thighs. Lax and shrunken. Hard and painful to touch. These are some medicines like conium are some medicines which should be on your text. Stitches in the nipple. Wants to press breast hard with hand like Brynia want to. Menses delayed and scanty. Part sensitive. Every menses delayed and scanty is not pulsatilla. Could be conium also. Breast enlarge and become painful before and during menses. Whereas in calcarea cough, it was not that painful during menses. And in Laccan also, there is pain in the breast before menses, rashes before menses, itching around the pudenda, unready conception, induration of os, hardness of os in cervix, means cervicitis also, it can help cervicitis also. Ovaritis, enlarged ovaries, indurated lengthening pain, like it can help in endometriosis also. When there is, the lining is created on the ovaries, they become hard. And in the para-ovarian cystic disease also. Ill effects of suppressed sexual desire or suppressed menses or from excessive indulgence in sexual activity. And patient will tell you whenever I go to pass urine, some white discharge also comes along with it. So leukorrhea with micturition, these are very common symptoms you will find if you'll have a lot of female patients coming to your clinic. Colocin, again, the best painkiller available to a homeopath when we have to treat a case of endometritic pain, endometritis pain, or ovarian pain, boring pain in the left side of the abdomen, which is better by drawing up the leg, great restlessness, round small cystic tumors in ovaries, the broad ligaments. Again, it can also help endometritis, I told you, ovarian cyst. Wants abdomen supported by pressure, bearing down cramps, causing her to bend double. Opium, in opium also, the same modality comes. And in collinsonia also, when there is lot of ovarian pain, the patient feels better by drawing up the limb. Carboanimalis, if you are treating lot of female patient with tumors, you should be very, 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 very much familiar with this remedy. It has nausea of pregnancy, worse at night. Lochia offensive. Offensive lochia, offensive discharge from uterus is again seen in creosote, rustox, and CK alcohol. Menses come too early, too frequent, long lasting. And what is the keynote? Followed by great exhaustion. So weak, can hardly speak. If it is the case of cancer, tumor, patient is so weak, cannot bear. Patient will tell, I'm so hungry, I wanted to eat, but I get tired eating, chewing food. This kind of weakness. Otherwise, this kind of weakness, like great exhaustion, so weak, can hardly speak during menses, and severe pain in thighs and legs. These are also symptoms of cocculus. Again, in carboanimalis, the flow comes only in the morning. Same with borax and sepia. Burning in vagina and labia. Darting pain in breast. Painful induration in breast, especially right. Cancer of uterus. Burning pain down the thighs. Pain in coccyx. Burns when touched. Ankles turn easily. Straining and overlifting produce great debility. So all these symptoms could be a symptom of a cancer patient who's suffering from breast cancer or uterus cancer, and the main indication is ball-like swelling, blue ball-like swelling, whether it is in the breast or in the uterus. Ball-like swelling growing from the uterus through the navel towards the upper abdomen. Easy discoloration, pain in hip joints at night, night sweat, fetid and profuse. Night sweat, you can see night sweat in calcarea carb, conium, calicar. Night sweat, fetid and profuse, wrist pain, but no proper location is being mentioned here. So if it is on the head, profuse, wetting the pillow, it is calcarea carb, and it is on the head only after sleeping, closing the eyes, it is in the case of conium. And if it is throughout the body, the patient is completely wet, it could be carboanimalis plus 4 or 5 symptoms, or other symptoms also should match. The patient desire to be alone, sad, reflective, avoids conversation. There is a lot of anxiety at night with orgasm of blood. Variety mu, catamania too early. You know catamania? Headache before menses, headache due to hormonal changes, due to periods, it's called catamania too early. Like if it is, there are 15, 16 days left, uh, you know, after 15, 16, from the middle of the cycle, the headache starts coming, symptoms starts appearing. Pain as from a bruise in the cavity of pelvis, such a kind of pain. Sterility, leukorrhea, induration, tumor or atrophy of ovaries. A lot of people who suffer from atrophy of ovaries, you can see. Nymphomania, you can prescribe Bariatrium. Bariatrium iode, again, it acts on lymphatic system and glands. It increases leukocytosis, indurated heart glands, tonsils and breast. After months, lot of females, you can see so many females, after having mumps, they suffer problems and swellings in breast and also ovaries. Tumors of ophthalmia with tumefaction of cervical gland and stunted growth. Tumors. Then constriction in uterine region and ovaries, dysmenorrhea, pulsating pain in uterus and ovaries, vaginismus, menses early dark pitch light. Dark and pitch like menses are also in cocculus and magnesium car, which sees on lying down. Otherwise, in Bovista, what was happening? It used to happen only when she used to lie down with heart symptoms. Cactus is the wonderful medicine when somebody feels as if there is some clutching feeling in the uterus during menses or dysmenorrhea. Now coming to another wonderful remedy of uterine cancer, uterine tumors, and a uterus with multiple growth, intramural fibers, Fraxinus americana. Dr. Burnett was a great fan of this remedy, this mother tincture. Enlargement of uterus means bulky uterus, fibrous growth, subinvolution, and prolapse. All conditions of the uterus. Uterine tumors with bearing down sensation. The uterus is so bulky and having so big tumors that there is a bearing down sensation due to that. Fever sores on lips, cramps in feet, cold creeping and hot flashes like lachesis. There's cold creeping and hot flashes. Throbbing pain in the back of head, depression with nervous restlessness, anxiety, hot spot on top of the head. Patient will tell you that a lot of heat coming out of the top of vertex. Uterus enlarged and petulous, watery, unirritating leukorrhea. Fibroids with bearing down sensation. Cramping in feet because there is lot of heaviness coming down, so there must be cramp in feet. Worse in afternoon and night, dysmenorrhea. Tenderness in left inguinal region. Bearing down pain extending down thigh. So if females can sometimes mention, doctor, the pain goes to the left inguinal region also. So it is very important to, when we are taking a modality or talking, asking about the pain, to take the, to know about the extensions of that region of pain. Ferrum iode, again another good remedy. Patient feels like sitting, on sitting feels like something pressed upward in vagina. Whereas in Lilium pig and sepia, we have seen that the female feels something is coming out in the vagina. But in ferrum iode, it's just so strange feeling. So we should have this in our mind. If some patient tells us, doctor, I feel when I sit, something goes up in the vagina. Otherwise, much bearing down, retroverted uterus and prolapse of uterus, leukorrhea like boiled starch. These are the indicated symptoms of this remedy. Menses suppressed or scanty, itching and soreness of vulva and vagina, scrofulous affections, glandular enlargement, and tumors call for this remedy. Crops of boils, acute nephritis following eruptive disease, uterine displacement, body emaciated, anemia, exothelmic goiter following suppression of menses. Means cases of female will tell you I am suffering from thyroid from many months, and then slowly I contracted this dysmenorrhea. Then now I have bearing down pain. I have second degree prolapse uterus. But when I sit, I feel something goes inside on itself. Impetigo on cheek, debility, anemia. Then you can easily think of paramyose. Graphitis, again, the commonest remedy we can easily find ladies who are giving symptoms indicating to graphitis in our clinic. Chubby, fair ladies, bothered about the trifles. Menses are too late with constipation, pale and scanty with tearing pain in epigastrium. These ladies, they have menstrual troubles associated and also associated complaints, and associated complaints they must be suffering from uh, gastric erosions or ulcers in the food pipe, pain in epiduodenal ulcers, pain in epigastrium and itching before, hoarseness, cough, coryza cough, sweat, and morning sickness during menstruation. The most indicating thing is morning sickness during menstruation. Leukorrhea, pale, thin, profuse white, excoriating with great weakness and back. Mammae swollen and hard. Induration of ovaries and uterus. Hardness of ovaries and uterus and mammae. It covers all the, female sexual organs. Nipples sore, cracked, and blistered. Decided aversion to coitus. She's so sensitive. She's having so much pain in the sexual organs that there is decided aversion to coitus, or there's so much irritation. She's having dryness of the skin, cracking everywhere, stretching feeling everywhere. Constipation is bothering her rectum. Her breast is hard and swollen. There is induration of ovaries and uterus, and there is profuse leukorrhea draining her out. So you can give graphitis and help that lady. Now there are so many ladies who, after two, three children or sometimes, or they're working, then according to the nature of their job, they had to get this abortion, undergo abortions, and they don't take rest after abortion. And after abortion, still some inflammation remains in the ovaries and the uterus or the other ligaments. There is dragging in the sacral region because during abortion they pull the cervix out and then they do the procedure and then it has to go inside. Sometimes it doesn't get better after the abortion. There's still the dragging in sacral region with prolapse, especially after miscarriage. Pruritus vulvae, backache after miscarriage, weight and soreness in womb, consciousness of womb means there is no proper subinvolution of womb. So there is again, all the time heaviness, feeling of heaviness in that area. Rawness, menses too frequent, too profuse, leukorrhea, breast is swollen because she had an abortion, but she did not rest. Her hormones did not settle. The body did not settle, never recovered from that abortion. Breast swollen, nipples pain and tender, parts hot, red, swollen, burn, itch terribly. Albuminuria of pregnancy, debilitating, great debility attending the menopause, and there is lot of means poor function of the entire sacral plexus, that they have problem in urination also. Poor function of kidneys. So halonias is indicated in women who had abortions, recurrent abortions, and never recovered after that. After abortion, she suffered dragging pain in the back, swelling in the legs, scanty urination, swelling, puffiness in the body, anemia. You can give halonias and give good results. Get good results in that lady. Ipecac, again a well-known medicine for uterine hemorrhage. Profuse, bright, gushing with nausea, vomiting during pregnancy, pain. Typical, what is the indication? What kind of dysmenorrhea? It is pain from navel to uterus. Lot many young girls and ladies will tell you about this kind of pain. And with a clean tongue and nausea, measures too early and too profuse, you can prescribe Ipecac. Iodium, the name suggests it will work on the glands. There is profuse weakness during menses, increased hunger, and menstruation is irregular, uterine hemorrhage, there is inflammation in the ovaries, wedge-like pain from ovary to uterus, dwindling of mammary glands, nodocytes in skin of mammae, small, acrid leukorrhea, thick, slimy, corroding the linen. This is very interesting. you will ask or you'll get to know if you'll have a good practice in women. Because it's a very, very personal thing. Lot of women uh, find that in their underwears, they find that there is a hole, and it is due to the leukorrhea. It is so acrid. I got two, three patients who told me this, and they were smiling, and they were themselves they were making fun of it because the mother told me this thing. So all her undergarments are spoiled like this. So this was a good indication. I gave her iodium, and she got much better. She was a dark, thin, scrawny girl, although very active. So then iodium helped her a lot in PCOS. Creosote, best medicine of uterine cancer, best medicine for cervicitis, best medicine of Lebothanian cyst, bleeding, ulcers in the um, outer layer of cervix, corrosive itching with vulva, burning and swelling of labia, violent itching between labia and thighs, during menses, difficult hearing, buzzing and roaring, eruptions after burning and soreness in external and internal parts, leukorrhea, yellow, acrid, odor of green corn, worse between the periods. Leukorrhea is offensive. Or patient will tell you, so how would you get to know this cervicitis? Every time the patient is with the husband, there is hemorrhage after coition. Mens is too early, too prolonged, coming every 20 days, staying for 8 to 10 days. There is vomiting of pregnancy with excessive saliva in the mouth. Menstrual flow intermittent, cease on sitting or walking, reappears on lying down. Pain worse after menses. Lochia offensive intermittent. Creosote is the best medicine in the worst cases of uterine bleeding where the bleeding is offensive and there is unmanageable itching in the labia, vulva, thighs, pudenda. Creosote helps. Latex is again the most known medicine to treat the female pathologies during the menopause, hot flushes, behavior changes, uh, violence in the nature, vertigo, headache, fainting spells, worse pressure of clothes, men's is too short. Patient will tell it happens for one day only. Too feeble, pain is relieved by the flow only. Left ovary very painful and swollen, indurated, mammae inflamed and bluish. There is severe pain in coccyx when especially when patient wants to rise from the sitting posture. Act especially well at the beginning and close of menstruation. But
Yes,
if it happens all the time, Ruta is the best medicine for this kind of backache.
yes, madam. We have just only 4 minutes remaining. Let's just
Okay,
have a second session in the coming days as
okay,
per your
okay,
convenience.
okay, okay.
Okay,
So
we
similarly,
need.
there are more medicines which help. There are so many medicines which can help the female pathological disorders. You have to just take the right symptoms, and we have medicines for all of them. All of the medicines for all of our sisters. This is the beauty of homeopathy. It helps so much with the individuality, and it can help everyone if it is rightly chosen. So this is what I wanted to share with you all,
Yes.
and thank you very much for the patient hearing.
Yes, Dr. Mehta, it's really a very good session. You really show the beauty of homeopathy in managing all this kind of female diseases, and you have come up with the medicines also. That's a very good thing because we have lot of medicines for managing female complaints. Unfortunately, people are yet to know about. Some people are only very few people know about all these things. We need to take this thing to public so that common people will know about all these things and they may come to homeopath for the homeopathic treatment so that we can give better cure than any other system even without removing. We can avoid lot of surgeries if we use this kind of treatment, as well as we can avoid a lot of hormone therapies if a patient come to us early from the very beginning of the problems. Am I right, madam?
Yes, yes. So you're
Yes.
very right. Nowadays, we can treat this endometriosis, which is, affecting a lot of young people who have not started their married life even. So, and they have only one solution that they can remove the entire uterus and ovary and everything. So there we can help a lot.
Yes, Dr. Bhavan, Danny
Yeah,
Bhavan. Yes.
yeah. A basic question, madam, to you. Actually, for to increase the faith of homeopathy in patients, we should actually overcome this problem. Many times, females they come to us for DUB, that is dysfunctional uterine bleeding, and sometimes it is very difficult to use the common remedies like we have seen. I have used millifolium, ipecac, phosphorus, but the results are not so assured. So, how to approach such cases, and can you guide us some hemostatic medicines
Yes.
for that?
No, no, no. Then, if you are unable to treat them with this hemomalus epicat, then you need to find uh, the real cause for the problem. Because in the cases of dysfunctional uterine bleeding, I will tell you, most of the cases they have emotional reason behind that. I'll tell you, I'm treating a lot of cases in Delhi, and these are the teachers working in the school who have a time set to, submit the papers or some audit is going on. Argentum nitricum is treating everybody or
Okay, so
some female
anticipatory anxiety.
argentum, yes, argentum, you give this medicine to the ladies, it is going to treat the cancer even if somebody is having such kind of mentality. In cases of grief, Ignatia will settle this whenever she'll
Okay.
get emotional. So
Yes.
you have to find out the emotional reason or some torturous condition behind this lady or what
Yeah,
is
I
something
see.
she's trying to manage.
Yeah, and do you
Because
use mother? Do
because
you use
menstruation sheds out the stress in your mind.
Okay. Do you use mother tinctures to control the bleeding of patients?
I think once only I used erigeron, and that
Erigeron,
was
yeah.
it was not a mother tincture. It was in six potency.
Okay.
Yes, definitely we will have a second part of the
Yeah.
presentation so that the more people can ask questions and you can clarify the doubts from Dr. Minimeta. I invite Dr. Sarvi Pasula from Turkey to say a vote of thanks to the session.
Hi, Dr. Danish. Thank you, Dr. Mehta. It's a wonderful session, and we learn a lot of things. And I hope you will continue the next session. And I want to ask you what was about the etrusia in the female, mainly uterus cancer. What was? Do you have
Which
any
one is that?
experience? Thank you, IFPH, at the same time,
Which one is that?
because every evening is wonderful. You learn wonderful things. Thank you.
Thank you, Dr. Sarvi Pasilo, Dr. Mini Mehta, and those who participate in this meeting. And we will definitely arrange a second part of the session in the coming month itself as per the convenience of Dr. Mini Mehta. She is always willing to share her knowledge as well as she is a person who is capable of clearing the doubt also. So thank you once again to all participants, and tomorrow we will have a presentation from Dr. Rohit Sharma from Canada, and Dr. will be talking about homeopathy for childhood behavioral issues. Thank you all. Good night. With that, we come to the end of the day 1662. It's over to Dr. P. Shaila to moderate the Malayalam session.
Good night. Good night, everyone.